Hello, I am Linda Kumalo with Pima Council on Aging, and this is a presentation on hospice care and Medicare fraud. In this presentation, we will go over what hospice care is and how we can be on the lookout for fraudulent activity where Medicare is concerned. First, let us go over how hospice works. According to Medicare.gov and the Center for Medicare Services, hospice is a program of care and support for people who are terminally ill. There are 7 important facts to consider about how hospice works for Medicare beneficiaries. Hospice helps people who are terminally ill live comfortably. Hospice isn't only for people with cancer. The focus is on comfort, not on curing an illness. A specially trained team of professionals and caregivers provide care for the whole person, including physical, emotional, and spiritual needs. Hospice services typically include physical care, counseling, drugs, equipment and supplies for the terminal illness and related conditions. Care generally is provided in the home. Family caregivers can get support. What is Medicare hospice fraud? Hospice fraud occurs when Medicare Part A, that's the hospital coverage part of Medicare, is falsely billed for any level of hospice care or services. In the next slide, we'll see some of the examples of Medicare hospice fraud. And these include falsely certifying and providing services to beneficiaries who are not terminally ill, that is, with a life expectancy of 6 months or less if the disease runs its normal course. Enrolling in hospice without the knowledge or permission of the patient or family. Falsely certifying or failing to obtain physician certification on plans of care. Paying gifts or incentives to referral sources such as physicians and nursing homes. Billing for a higher level of care than was needed or provided or for services not received. Targeting assisted living facility and or nursing home residents whose life expectancy exceeds 6 months. Using high pressure and unsolicited marketing tactics of hospice services. Providing inadequate or incomplete services, including, for example, no skilled visits in the last week of life. Providing or offering gifts or incentives, including non-covered benefits such as homemaker, housekeeping, or delivery services to encourage beneficiaries to elect hospice even though they may not be terminally ill. Embezzling, abusing, or neglecting beneficiaries or medication theft by a hospice worker. Keeping a beneficiary on hospice care for long periods of time without medical justification. Providing less care on the weekends and disregarding a beneficiary's care plan. Now let's look at what Medicare paid for hospice in 2019. There are 3 different categories for hospice care, according to Medicare. One is routine home care, and the second one is general inpatient care, and then you've got continuous home care. Routine home care pays $195.40 per day for the first 60 days of hospice. That's the first 2 months. And for the remaining 4 months, they paid in 2019, $151.41 per day. General inpatient care paid an even $758.07 per day for all the 6 months of hospice care. Continuous home care paid $997.77 per day for the entire 6 months. So in that case, how then are fraudsters benefiting from hospice care? So general inpatient care, as we saw in the previous slide, and continuous home care pay significantly more than routine home care. So falsely signing up someone for hospice and then providing routine home care at a continuous home care rate could be very lucrative for a fraudster. So what then can we do to stop hospice fraud? As SMP, Senior Medicare Patrol Officers, we always want to make sure that we protect ourselves from Medicare frauds and errors and abuse. You detect them as soon as you receive your statements and you report whatever concerns you may have about your billing and the level of service that you're receiving. One of the ways you want to make sure that you're properly enrolled in hospice or that your loved one is properly enrolled in services is by making sure that your doctor has assessed your condition. Be sure that your doctor has certified that you are terminally ill and expected to live 6 months or less if the disease runs its normal course. Never accept gifts such as money, gift cards, or groceries in return for hospice services, and be wary of too good to be true offers. Always report quality of care complaints to your local SMP, of which Pima Council on Aging is one, and the Beneficiary and Family-Centered Quality Improvement Organizations, that is the BFCC-QIO. If you have any questions or concerns, please contact your Senior Medicare Patrol Counselor at Pima Council on Aging, and the name is Linda Kumalo. The number is 520-546-2017, or you can email me at lkumalo@pcoa.org. Thank you.